My name is Dr. Torabi. I'm an interventional cardiologist at Franciscan Physician Network, and I'm at the Crown Point and Munster campuses. The patient that happens to still be on warfarin, unfortunately, you probably do need to have some consistency with your green leafy vegetables. It doesn't mean don't have them, but it just means that you got to have some consistency so you don't have these large fluctuations on how therapeutic your blood is on that medicine, warfarin, or also known as Coumadin. That was a very more common problem on a lot of our patients that were on a much older type of blood thinner, particularly warfarin. Or Coumadin, as it's also known, and that is a medicine that essentially, blocks vitamin K, and essentially there are a lot of food in your diet, particularly those green leafy vegetables, which at the time, depending on someone's diet, can really cause fluctuations on how this medicine works, and that can really cause fluctuations on how thin your blood is. And for a lot of patients that were on that medication, they had to kind of have a consistency with their diet and their green leafy vegetables. A lot of patients now, if they're on warfarin, it's because they choose to be on warfarin, because that's what they've always done, and they have this adage that, hey doc, if it ain't broke, don't fix it, I want to stay on it. Or it may be a cost issue. Unfortunately, for some patients, even with insurance, they may find that these direct oral anticoagulants, that's your rivaroxaban and your apixaban or your Xarelto or your Eliquis, those are the generic and trade names, are just still too expensive.